My name is Jeff Baldwin. I'm an instructor with Alamance County Community College, and also I'm a full-time EMT with Alamance County EMS. On the slide here, you'll see an email address, emsrescue60@gmail.com. That's my email address, so feel free to reach out to me anytime you'd like with any questions or comments, and I'll be sure to reply to those as soon as I can. So let's move on. The title of this lesson is How to be the Best EMT on an ALS Unit with a Paramedic Partner. You might be questioning yourself saying, well, what do I need this for? I might be the best EMT there is out there. Yes, I know I am the best EMT there is out there. But, again, you might not be. So, during this time together, we might try to help you to pick up on some pointers and some tricks that you might can become the best EMT there is on an ALS unit when you have a paramedic partner. So, the first thing we need to do is figure out what EMTs are. They're a crucial role in the ALS team. You have to set goals. You have to work together as a team. You have to have efficient operations, and you have to have excellent patient care. That's what we all strive for, is to make sure that we give the patient the best care that we can give. And as an EMT and a paramedic, that's what you're supposed to do. So, what kind of success can we do? Well, we can have success by having good communication and being a competent partner. Good communication can be with the paramedic partner or the ER staff, the family, and even the patient. Communication is a vital part of our job. Next thing you need to do is you need to get to know your partner. When you start out your shift in the morning, you need to ask your partner, hey, how you doing? My name is Jeff Baldwin. What's your name? Unless you're with a partner that you're with every day and you know their name and you know how they act and they function and what they do. And if that's the case, well, then you don't really need to know how long they've been a paramedic, what they've been doing. But it's still a good time to say, hey, how was your weekend? How was your day off? What's going on? What's happening in your life? Is there anything that's going on that we can talk about? Or, hey, you been to Disney World lately? Yeah, been on a vacation? Been any new restaurants? All right, so if you're with a partner that you've never been with before, and it's a paramedic partner, because in this case, we're talking about a paramedic partner on an ALS truck, then you ask them, say, hey, how long have you been a paramedic? How long have you been in EMS? What type of calls do you like to run? You like trauma? You like medical calls? You like no calls? You like sitting around? Hey, everybody likes that. Let's sit around, run no calls, and get paid to do nothing. I like that. Sleep all night. Work none during the day. Works good for me. Do they like to drive? Do they like to drive to the call, or they like to attend? I've been with some partners that say, hey, I'll attend every call if you drive. Sure, I'll do that. I'll drive you around Miss Daisy all day long. How do they like to run the call? What I mean by that is, do they like to go into the house, talk to the patient, find out what's going on? Hey, you want to go to the hospital? Let's go. Get on the stretcher, push it out to the ambulance. I'm ready to go. Let's go. Nah, it don't work like that all the time. You go into the patient's house, you assess the patient, you find out what's going on. They called you for help. You're there to help them. It's like I tell people, you know what? They've called you for help. You're supposed to know what you're doing. If you don't, fake it, figure it out, move on. You'll get it right. So, how's your partner want to run the call? Find that out. Ask them, hey, what do you like to do? What's your style? How you like to roll on this thing? And they'll tell you. And when they do, roll with them. Do it. Get it done. And it'll work out. What's their limitations? What can they do and can't do? What do they like to do and not like to do? Everybody's got limitations. They might have a limitation of speaking. Especially some of these younger kids that's coming up. They talk too fast. They don't talk fast enough. Or they talk too slow. Or they talk too loud. Or they talk too soft. Well, guess what? That's where you can come in and help out. You say, hey, next time you're on this call, you might need to speak up a little bit. You're dealing with an older person that, guess what? As they get older, we can't hear anymore. It goes along with life. That's how it is. So, there you go. We need to figure it out. Figure out what their limitations are and what they can and can't do. And you might can help them out. Hey, you know what? You need to speak up a little bit when you're talking to that patient that's an elderly patient because they don't know what you're saying because they can't hear you. And if you talk so fast they don't even know what they say, huh? What'd you say? So, that's things that you can help your partner as you move along. Okay, let's move along to the next slide. What do we got? Introduce yourself. Okay, that's a big one. Tell your partner about yourself. They don't know you. If this is their first time being with you, they're probably as scared as you are. I don't know what this guy or girl is, or what she does, or how she's going to help me. I might get to a call and guess what? I'm paramedic. I'm on my own. Don't give them that impression. Tell them about yourself. Hey, I've been an EMT 20 years. I feel like I can handle everything that's thrown at me. Hey, I'll be right there for you. I got your back. No problem. Hey, we get into a fix and a bind. I got you. Tell them how long you've been in EMS. Tell them how long you've been an EMT. But the main thing is, tell them what your strengths and your weaknesses are. Hey, I struggle with talking with patients. Or you might say, I don't have a problem talking with anybody. Man, I can talk them either into going to the hospital, or if they don't need to go to the hospital, advise them where they do need to go. They might can have their care and their illness or whatever's going on with them taken care of at their doctor, at the clinic, somewhere else. They might not have to go to the ER. But you might have a patient that's hard-headed that don't want to go. And you got that strength where you're able to talk them into saying, hey, you really need to go to the hospital and you need to go now. Okay? Tell them what type of calls you like to run, what you like to have. Oh, I love medical calls. Or, hey, I really like trauma. Tell them what's going on and what's happening. Yeah, they need to know. Tell them what your goals are in life. What you like to do at work. What your goals are at work. Where you want to be in 5 years, in 10 years. They need to know this stuff about you. It's very important. They probably want to know it. They're probably concerned, especially since you're their partner for 24 hours. They want to know, do I have a knucklehead with me? Or do I have somebody that's got my back, that knows what's going on and what to do, so that when the hits the fan, they're going to be right there with me as a team player. Let's move on. Okay, so before that first call happens, And if that's possible, because a lot of times when you get to the station, guess what? Doo-doo, that tone drops and you get your first call immediately. Boy, you're out the gate running emergency traffic to that cardiac arrest, to that chest pain, to that breathing difficulty, to whatever it may be, back-to-back calls. That's how it goes sometimes. So, if you are able to get these things done, and that is, check your truck off together. Get in there and figure out you got all the equipment you need to run those calls that you're going to be running. Because it might be a long, hard 24-hour shift. And y'all are together, and you've got to make sure you got that stuff ready to go on that truck. Do they like to have the equipment placed in certain places on the ambulance? Some people like different things, different ways on the ambulance. Hey, if they do and that's what they like and they roll with that, then let's change stuff around so it makes it easy on everybody. Hey, remember, you're with a paramedic partner. A lot of times they're the ones that's responsible for what goes on that truck. You might have more years on them, but they've got a higher certification than you are, which is you're an EMT, they're a paramedic. So they are going to be responsible for a lot of things on that truck and what happens. All right, so let's ask them, what do you like to carry into the house when you get a call? You like to carry the monitor in the bag? Or you just like to start with the bag and we'll move to the monitor? You know, what do they like? It all depends on what type of call it is, for one thing. So if it's respiratory, you're going to need oxygen, you're going to need your bag, and you're probably going to need your monitor. If it's cardiac arrest, you need everything you got in the whole entire truck and some. Because everything that you need, you're going to need on that patient, and you're going to need it quick. How do they like the monitor set up? You know, there's a lot of pieces of equipment that attach to that monitor that's in the pockets of the monitor that can get switched around in different places, different things go in different pockets and stuff, and people moving all around so they know when they get on the scene of a call, they need to pull a blood pressure cuff out, a pulse ox out, 12 lead cables out. You know, there's things that they need to pull out. And they need to know where they are. And some people like them to put them in certain places so that they know where they can get to them quick. How do they like the med bag set up? Everybody likes the med bag set up a different way than what the person that was on the unit before them. So let them set it up. Change the things around a little bit. Hey, there's no problem with it. Whatever it takes so that things flow good and easy, and we get things done on the call together, hey, if they want to set it up a little different, then we do it. What do they like to do on that first call? They want to drive out of the gate, first thing, lights and siren, woo, 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 down the road? Or do they want to say, hey, I'm going to chill and sit back, I'll attend the first call, you drive? Hey, we're good with that. Whatever it takes. You know, we all do it different ways, and some people like to ride, some people like to drive. I mean, to me, I don't care. I do either of whatever it takes to make it happen, I do it. All right, the next thing you got to do is you got to know your roles. So, you're an EMT. What's an EMT? Well, you do BLS. It's basic life support. What does that consist of? Airway, bleeding, circulation, patient movement. You know, it's all the basics. That's what it is. That's why it's called basic life support. It's all the basics. All right? So, you've got that down. That's one of your roles as an EMT. What else can you do? Well, you can support the ALS part. That's the advanced procedures. That's when you have an IV, intubation, meds. That's all the ALS stuff. That's things that you can help your paramedic partner with. Get in there and help them. Help set up that IV. Get that lock ready. Tear tape for them. There's a lot of things that you can do as an EMT to help your paramedic partner. Make their job a little bit easier for them. Hey, everybody wins in this situation. Another thing you can do, especially if you have a scene that's involving motor vehicle accidents, scene management and scene safety. That's an important thing that you can do. If it's a motor vehicle accident with trauma, your partner's a paramedic, what are they going to do? Do the trauma care for the patient. What's something that you can do? Make sure everybody's safe on the scene. Make sure they have their safety vest on. Make sure that your ambulance is parked in the spot that's going to keep everybody protected from when you've got this crazy driver that's looking at the cars that are wrecked on the interstate because they've never seen a wreck before. Well, guess what? They bang and they hit somebody or they hit another vehicle because they're not paying attention to what they're doing and they make a mess. Hey, try to keep that scene safe as much as you can. Documentation is another thing that's important. When they're calling out vitals, write them down. Make sure you're documenting that stuff. That's part of the logistics of the call. And it should be your responsibility as an EMT to do those things like that. Know your protocols and review them. Hey, there's nothing wrong with, if you're unsure about a protocol, pull that book out and read it and figure it out and review it and make sure you know the next time you have that certain call, hey, I know that protocol. I just looked over it the other day. I'm familiar with that. I know what the dosage are on my medications. I know the contraindications. I know the treatments that need to be done for that respiratory patient, that cardiac patient, that chest pain patient, that leg pain patient, that patient that has asthma, emphysema, all this stuff. Look at those protocols, review them. There's nothing wrong with that. There's so many protocols in that book. You can't remember all that stuff. I mean, you've got enough stuff to remember as it is. Keeping up with your Con Ed and all your other stuff. It's nothing wrong with reviewing those protocols and going over it. Hey, it's better to be safe than sorry. So that first call, when it finally arrives, and when it does, you'll know, because you'll hear that tone drop, because it always drops when you don't want it to drop. I just sat down to eat my food. I just took it out of the microwave, and it's warm, and it smells so good, and I'm ready to eat it, and all of a sudden, what happens? Doo-doo. You get that call, and guess what? Up and going out the door you go. It finally arrives, that first call, or maybe it's your 10th call. Who knows what it is? So, when you're checking en route and you're looking at the CAD on your computer, and if your partner's driving, start relaying the information that's on the CAD to your partner. Don't just sit there and read all the information yourself. Let your partner know what you're going to, what's going on, what's happening. Hey, we're responding to a 47-year-old female that's complaining of chest pain, has a history of cardiac. She has a heart attack. She's had a heart attack 2 years ago. She had a stent placed in there. And now she's complaining of chest pain. It's been going on for the last couple hours. That's all the information that's coming up on the CAD. You need to read that stuff off to them. Read it off and see if, hey, when we get there, it looks like this call might be trouble. We need to make sure and check that the scene is safe. Y'all always want to make sure the scene's safe. Don't be running up in there and people acting all crazy and everything, and you get up in there and you're all hemmed up and you don't have anywhere to go and police are not on the scene. Check that stuff. Read those notes. That's what it's for. Find out. Hey, I don't think everything's right on this call. Or you might say, oh, it ain't no trouble. Everything looks good. Look at that call history on the call before you get there. It pulls it up on the CAD to find out, hey, we've been out there before for this patient. They had issues with this patient's family. So maybe we need to get police en route to see. Make sure you got additional resources coming that you might need. Hey, look and see. Is fire responding? Hey, this patient's over 400 pounds. We might need some lift assist. Make sure you got fire coming along. Hey, if it's a motor vehicle accident, got multiple patients, guess what? You might want to get your communications to dispatch another truck there to help you out, so that you've got another truck there that can help with transporting multiple patients if you got. All right. Then, when you arrive on the scene, you need to ask your your paramedic partner, what equipment do you need for this patient? What do you think we might need? You want the monitor? You want the bag? You need to ask them. What do we need to take into the house? What's our plan of action? What are we going to do when we get there? Do we put them on oxygen? Do we just transport? There's things that you need to figure out, you and your partner, what y'all going to do. And what's your next steps going to be? Hey, you're talking together. You're communicating together. You're getting it done. You're getting the job done. Because, like I said at the beginning, our goal is to have excellent patient care. That's what you and your partner want to do. That's what you want to strive for. Excellent patient care. When you get to the scene of the call, you need to know what's in your scope of practice. What can you do as an EMT? Well, you do basic life skills is what you can do. It's BLS, basic life. Find out if the call is a BLS call or is ALS call. That's advanced life support, basic life support. A lot of times you get on the scene and ask your paramedic partner, after you start evaluating your patient, say, hey, is this going to be a BLS or ALS? If your partner says, hey, I think it'll be a BLS. Okay, yeah, then you take lead and you do what you got to do. Hey, it's your call. You never know what's going to happen on the next call. It could be an ALS. You get dispatched on the next call, and guess what? It could be an ALS. You get dispatched on the third call of your shift, and guess what? It could be an ALS. You're getting back to back ALS, and guess what you become? You become an ambulance driver. All you're doing is driving to the ER with the patient and your paramedic partner in the back. Okay? So now, step up to the plate and take charge and take that BLS call. And if the next call comes in and he says, or she says, well, hey, I think this is BLS. Okay, I'll take it. Yeah, because you don't know if the next 3 calls are going to be ALS and your partner's going to be back to back calls, and you're going to get behind on your paperwork and stuff. So take that call. So when you get on that scene of that call, one of the things you can start doing is, as an EMT, is taking vital signs. Yeah, you need to find out what's the patient's vitals. Well, what kind of condition are they in? What's your treatment need to be? What's your plan of action? You need to start forming your plan of action. You get patient information. Hey, ma'am, how old are you? What was going on when this happened? What were you doing? How do you feel right now? Get all that information about your patient and get it sooner than later, because like I have always found out, if you're with a patient and that patient is someone that's talking to you right now, that's able to communicate with you, especially if they're by themselves there with just you, and that patient goes unresponsive, unconscious, and you hadn't figured out any information about that patient because you hadn't asked enough questions to get information from that patient, and you don't have anything, how are you going to do your treatment? I mean, how do you know that this patient, when they go unconscious, how do you know that they were diabetic when they went unconscious and their sugar dropped to where it made them go unconscious? You don't know. So in there in the beginning, get as much information as you can, especially that important information. A quick medical history. Things that you can figure out. And, hey, you might have to ask questions to figure it out yourself. Like, if the patient's not bringing out information, you might think they are. Say, hey, have you had any kind of major medical problems, like respiratory problems, cardiac problems? Are you a diabetic? That's key things you need to know. Do you have seizures? Things that you need to know so that You can form a plan of action and a plan to treat that patient, but you need to get that information out of them in the beginning of that call. Okay, while you're on the scene, like I said, you need to try to get all your vitals that you can. And a thing that you need to do is don't depend on that monitor. It's an electronic device. It can fail. It can go wrong. Get those vitals and write them down so you got them. You can still have them on the monitor as a backup, but guess what? You've got them written on a piece of paper. Guess what? When you get to the hospital, you can look at that piece of paper and you can talk to that nurse or talk to that doctor and give them a report. You've got all that information right there. Not that you got to have it up here and remember it. You've got it written down on a piece of paper so that when you're talking to them, you know what you're talking about. Get all that patient information that you can, like I said, from the beginning. Now, you probably want to perform any interventions that's needed to be done at this time. If that patient's having breathing difficulty and their O2 stats are less than 94%, guess what? I'm getting my patient on oxygen so they can breathe a little better. You know? Or if it's a patient that's a cardiac patient and they're having chest pain and they're not allergic to aspirin, guess what? I'm going to administer some aspirin to them. Get that stuff going. You know, that's interventions that you can do. That's important things, especially at the beginning. If it's a diabetic patient and their blood sugar is in the 50s, well, guess what? If they still got a patent airway and they're still talking and everything, I can go ahead and give them some oral glucose and try to get that sugar back up. And then maybe after that, I can maybe say, hey, you know what? Maybe it's time to try to eat something so we can keep that sugar up. Get a family member or even yourself to make them a sandwich or get them some food or something in them so they can keep that sugar up and get that back to normal. And that's interventions that you can do. You know, if you have a patient that's got low blood pressure, you know, you can help out your paramedic partner until they can get an IV and get them fluids going. You know, you put that patient in a Trendelenburg, that's a hard word to say, but that position, you get them legs elevated, you can get that blood pressure start to come back up a little bit, you know, until your partner can get that IV going and get the fluids in them. And that's something you can do as an EMT. And it's good that you can do that stuff. Talked about before, make sure you attend the call, especially if it's a BLS call, because you don't know how this shift's going to go and what's going to happen. You just don't. Hey, if it's a cardiac arrest, and we all hate those calls, you know, they're hard calls, not just on what the work you got to do in it. It's hard on the family and the people that are involved in it. You know, I feel sorry for people who have to go with it, but you know, death's part of life. And, you know, everyone's going to die eventually. I mean, it's sad, but do what you can on that cardiac arrest to help. Make sure that if the fire department's there and they got an airway going and they're bagging, make sure they got good compliance. Make sure they got a good chest rise and fall. That's things that you can do because, again, that paramedic partner is going to be trying to get an IV going. They're going to be trying to push those meds that are required on that cardiac arrest call. That's things that they're going to be doing. And so that's another thing that you can do is that airway. Also, the firemen that are doing the CPR, you help them out. You can do some compressions yourself. Or if they're okay and they have enough people that's doing it, you know, find out and make sure that they're doing the right depth, the right amount of compressions, the ratio that needs to be, and coach them through that if they need some coaching. Give them some encouragement. Thank them for what they're doing. It's hard doing CPR on a patient. We all been there. We've all done it. We know how it is. And it goes on and on and on. Another thing that you can do is speak with the family while everybody's busy doing stuff. And if you have the time, talk to the family, communicate with them, let them know what's going on. Let them know that you're doing everything you can to make sure that the outcome's good for this patient. Just do it. Don't give a lot of information to the family, but give some encouragement and some words that show them that you do care and that everybody are doing the thing that they need to do to help in this situation. Also, during a cardiac arrest, you want to look for important papers. One important paper that you need to find and have in hand and make sure it's all current is the DNR. Does the patient have a DNR? Do not resuscitate, which means if you find that from the beginning, then hey, the patient's wishes were to not be resuscitated. You need to honor those wishes and go along with that. Find that paper though, because without it, you got to roll on with those chest compressions and those ventilations until you do it for at least 30 minutes and contact medical control to find out what you need to do at that point after that time. Things that you can do to help your partner. Anytime you're on a scene, you should get all that patient information either from the fire or the family. All that patient information is important. You got to have all that stuff because you know what you got to do. When you get to the emergency room, they're going to ask you all this information about the patient, and you got to have that information to give to them because they're going to be relying on you to give them that stuff. Take all the vitals that you can take on that patient. Place that patient on the monitor if that's needed. That's another skill that an EMT can do. Put them on that monitor. It takes a few minutes to get everything together and the monitor all placed on the patient with the 12 leads on them. But that's something that you can do. Again, that's another skill as an EMT that you can do to help your partner out. Also, another thing you can do is if your partner's going to start an IV, you can help with the IV setup. That's an easy thing to do. Pull out the setup kit, hand it to them or open it up, get some stuff out, tear some pieces of tape out for them, get that saline lock set up for them so it's ready to go. Find out what gauge catheter they're wanting to use and get it ready for them. And then when they're ready to get that IV done, they can get that IV done and you can, get that lock to them. They can set that lock up, and then if that patient needs fluids, well, guess what? Have that fluid bag ready to go, that IV bolus. Give it to them so that you can get started on that patient. Again, what's our goal? Good patient care. Another thing you can do is you can administer O2 to the patient. As an EMT, they're having breathing difficulty and they need oxygen. You put them on, whether it's a nasal cannula or whether it's a non-rebreather mask, depending on how they're breathing and what they need. This might be a patient that needs CPAP. Again, that's another skill that you can have ready to go and get that stuff ready for that patient so you can administer that CPAP. Things that you can do. Let's do it. All right, during transport. What are we going to do during transport? Well, if you're in the back with the patient, either by yourself or with your partner, there's things that you can do. There's a lot of stuff that needs to be done before you get to the hospital. Not just sit in that captain's chair and just look around. You need to get another set of vitals. You need to be assessing your patient's vitals, especially if it's a long transport. 5 minutes, 10 minutes, you need to be getting another set of vitals. You can help with the IV setup and the fluids, again, if that's something that needs to be done. Any kind of medications that the paramedic's going to administer to the patient, that's things that you can do. Pick up those meds and find them and do a med check with your partner. And then if they need to have them drawn up, well, if you know what you're doing, draw up the meds for them. That's another thing you can help your partner out with. You can also, like I said, make sure that your vitals are recessed. And also another thing too, if it's a respiratory patient, make sure they got capnography on. A lot of times that's a skill that's missed. You want capnography put on that patient so that you can get some good readings. Then Finally, the thing that you need to do before you get to the hospital, guess what? You need to tell them you're coming over there. What you got, what your patient's got going on. How old's your patient? Give them some information. Do a good encode to the ER. Let them know at the emergency room that you're coming, whether it's emergency, non-emergency, and what they need to be expecting. Hey, they need to be ready for you, so when you hit that door, that patient needs to go to a certain place in the hospital, in the ER. Well, hey, they can direct you there if you've given them the right information. So get that encode right. Do it. Give them that information, what they need, so that they can make it happen with the patient going to the right room or the right area of the hospital. So when you get to the hospital and you arrive there at the ER, if you're attending in the back, then there's things that you need to do when you get to the hospital. One thing you need to make sure you do is make sure that everything's unhooked, that you hooked up in the truck. Make sure it's disconnected. Don't have the oxygen tubing hooked up to the oxygen tank that's in the truck. That's the big tank. You know, the oxygen's going to run out faster on the smaller tanks than it is the big tank. So what you want to do is when you're transporting the patient, you want to disconnect the oxygen that's on the stretcher, the smaller tank, to the big tank in the truck. But when you get to the hospital, don't choke your patient by having oxygen gels set up already to the big tank. Unhook it and hook that oxygen up to the small tank. You know, there's things that you can do like that. If there's an IV going, the bag fluid, make sure you take that bag. If it's hooked up on the back of the truck on one of the hooks, make sure you unhook that and attach it to the IV pole on your stretcher. Again, if you in a hurry and you pull that stretcher out and you hadn't disconnected that stuff, guess what? You're going to pull that IV out line and your partner's going to be mad because they might have been a hard stick for that patient. And now you've lost that IV. Man, that's a bad day, a bad thing. So make sure, though, that you also have, we're talking about the oxygen tank, make sure that you've got a smaller tank of oxygen that's full and not empty. Don't do you any good to have an empty tank. Make sure you got oxygen available so that when you move that oxygen over from the big tank to the small tank, you've got oxygen for your patient going into the emergency room. Patient demographics. That's another thing you need to make sure. You know, we talked about earlier about writing it down on a piece of paper. Well, if you did, and you did that, and you got your patient demographics, when you get in there and registration wants to know what's your patient's name and your date of birth, you got all of that on a piece of paper. That's important. Also, if you've picked a patient up from a nursing home, they send a lot of paperwork with that patient to the emergency room. Make sure you give that paperwork over to the nurse or doctor there at the emergency room. You don't need that paperwork, and you sure as heck don't want to throw it away. Give that to them. They need that paperwork, and it's important. Then your final thing is helping moving the patient over to their bed. You know, don't just stand around. Do that. It doesn't take but just a few seconds to move that patient over, and the more help to move that patient over, the easier it is on the patient, and the easier it is on everybody else, especially their backs. Okay, so after the call, what is the things that you need to do? You got to clean up the ambulance and the equipment that you used on the call. You got to replace all the equipment and the supplies that you used. You got to restock anything that you might have used that needed to be on the ambulance. Or, guess what? Things you might have missed from the last call because you were so busy that you didn't have time to restock the stuff. Now's the time that you're thinking that you can restock that stuff so that when you get to the next call, you got the equipment and the stuff that you need to do to be able to function on that next call. Also, you might want to help your partner with getting any of the forms signed, such as a signature form pad, so that the ambulance service can get their money, because you know what? Those rides are not free and they're real expensive too. So you want to make sure that the signature form is signed either by the patient, or if the patient can't sign it, you get somebody at the hospital like the doctor or the nurse to sign that form so that your billing company that does your billing can file that bill with the patient's insurance so that the EMS service can get paid. All right, then the final thing is you need to make sure that you put everything back in the proper place on the ambulance so that when you get to that next call, all the equipment, everything is ready to go. All right, so when you start returning to the base from the ER, while you're returning, possibility is to be a good time with you and your partner to maybe do a debriefing. Talk a little bit, find out, hey, how do you think that call went? Is there anything that I could have done better on that call? I hope we can work things out if we've had something go wrong on that call, and that might be where you go back to the base and you go over a skill to figure out, well, hey, I might have done this wrong, or your partner might say, well, hey, you know what? I think you did it like this, but next time this way might work a little better, and it might make the outcome be a little bit better. So let's try it like this. You know what? It's a time to ask questions about the patient treatment, to ask them, how they feel about what you did and what the treatment was. Also, if you have any concerns, this would be a good time to get with them on that. Hey, I saw you doing this, but did you need to do it like that? Or did you need to speak that rough to the patient? Express those concerns to your patient, to your partner about your patient. It's something you don't like, talk with them about it first before you go to the supervisor or to somebody else and start whining about it. Get it right with them first. If you can't get it right with them, well then, hey, it's maybe time to go talk to somebody else about it. But try to get it right with them. Ask your partner if they would change anything different that was done on that call. What would you have done different than what we did? Being nice is a big thing that you can do. And one thing you can do, you ask your partner on the way back to the base is say, hey, you need to stop anywhere for anything? Any snacks or drinks? Anything you might need? That's just part of being nice. Hey, you can do that. It's not that hard. When you get back to the base, there's a lot of things that need to be done when you get back there. Again, if you couldn't get the supplies that you need to be restocked at the hospital, you might have to get them when you get back to the base. So if it is the case, go ahead and get them. Get that stuff before you forget and you get busy and get on another call and you forgot something. Make sure the truck's clean. Every call, you're going to have blood. You're going to have other stuff going on that might get on the truck, might get on the equipment, the floor of the truck, the seats of the truck. Hey, clean it. Everybody wants a clean truck. You don't want to sit down in something that you get on your clothes that you wish you hadn't gotten into. Make sure that you get everything back that you used on the call. It's important to have all the equipment ready. You don't want to pull up on the next call and say, oh no, I forgot to replace the oxygen. Guess what? I'm sorry, Mr. and Mrs. Jones. I can't give you oxygen today because I forgot. We're out. That's not a good thing. If you had trouble with a skill that you were on that call, hey, it's a good time to ask your partner, say, hey, can you help me out with this skill? I was struggling with this and I feel like I need to go over it. Get them to go over it with you. But you know what's a great thing to do? If you can't get your partner to help you, Google it. That's a great thing. Look it up on Google and see if you can find out if there's any YouTube videos or something. I've done that multiple times, and it's amazing of what I've been able to find that has helped me with some skills that maybe I hadn't done in a while, that I can see, oh, wow, yeah, this is how you do it. I remember that now from 100 million years ago, whenever it was I took my class. Another thing to do when you get back to base, report any kind of issues that you might have had on the call, such as equipment issues, mechanical issues with the truck, or if there's been any kind of exposures for you or your partner that y'all were exposed to that you need to report. That's things that you need to do when you get back. So when you're at the base and you're waiting for that next call to come in, well, you hope it doesn't come in, but you know it's going to come. Probably at 3 in the morning, it's going to be that call where that patient's going to say, well, I've been sick for 3 months, but I just decided at 3 a.m. this morning when it's 20 degrees out that I'm going to call you and go to the hospital. How many times do we hear that? You waited at 3 a.m., it's 20 degrees out, and you want to go to the hospital to the ER, and you've been hurting for 3 months and just decided you want to do it. We all hear that. What are you going to do? Okay, smile on your face. Well, come on, let's go. We're here. We'll take you to the hospital. I'm so sorry you're feeling bad. You know what? That's part of the job. It's what you got to do. You got to catch up on any base duties when you get back, because if you've been busy and running calls and back calls, there might be some base duties that haven't been done. Hey, jump in there and do them and get them done. Everybody wants a clean base. You're living there for 24 hours. You don't want to be living in a pig pen. You want it to be comfortable and nice, especially for the short time that you're there. But when you're there, you want to enjoy it. Catch up on the time with your coworkers. This is a good time to do that. Ask them about their families. How have they been doing lately? Make sure that everyone's okay. Some calls are hard on our coworkers, and you want to make sure everybody's okay. One thing you need to make sure you do is take that personal time for yourself, especially during your downtime. You need a little rest too. You need a little rest mentally, and it's important that you do that and take that time for yourself. At the end of the shift, you need to remember to replace any items that you didn't replace earlier. You need to make sure your truck is clean. Inside the truck especially, you should have already washed your truck the morning of your shift. That's usually what we do. Make sure that your fuel level is at the required spot it needs to be at before the shift ends. Ours is 3/4, so it needs to be at least 3/4 to full before we turn it over to the next shift. Have all the equipment ready to hand over to the oncoming crew. Your walkies, your pagers, your computer, anything like that. You need to make sure that stuff's ready there, not in your bedroom. Make sure that it's ready to hand to them personally, so they don't have to go looking for it and not find it, and then you have to get a phone call because you left the pager in your pocket and you took it home. You got to bring it back. That's a headache for everybody. Just make sure that it's up. Usually we put ours up front in the truck, in the seats, so that when the next crew comes in, they see it there, and then they can do whatever they want to with it, but we're turning it over to them. Make sure you've talked with your partner to see if there's anything else further that y'all might need to do that you've missed. And then make sure all your paperwork is completed and turned in. It's important. If not, you're going to hear from the front office about it. Before you leave the station for the day, make sure that there's nothing else that needs to be completed, like we said before you leave. You need to advise the crew chief of any equipment issues you might have had during the shift. All personal items that you brought in, you need to make sure that you have them with you or they're stored away. Check the schedule for your next shift to make sure where you're going to be. Acknowledge your partner that you've enjoyed the shift on time with them and that you look forward to another shift with them together soon. It's what I usually do. And the final thoughts and comments. Things you can take away from this lesson is you can be the best EMT that you can be, but it's going to come with years of experience. So you just keep practicing to be that, and eventually you're going to be. Be the best person you can be. Everybody can be a good person. You got to try and do it. Always be cheerful no matter how the shift goes. So when that person calls you at 3 in the morning and they are sick and they just can't take it anymore, be cheerful and say, okay, well, I'm so sorry that you feel bad and you're sick. Come on, we'll be glad to take you to the emergency room and get you some help and get you checked out. You know, everybody makes mistakes. Nobody's perfect. Just remember that. Any kind of medical terms that you've heard on that shift that were mentioned and you're unfamiliar with or maybe you've never heard before, look them up. Google them again. Like I said, Google. That's your best friend. Find out, if it's something you've heard and somebody say a medical term, you know, research it out. You might learn something yourself. How about meds? That's another thing. There's a lot of medications out there. So take those meds, write it down if you can't remember it, and look it up and see. So next time when you're on a call and a patient said, hey, I'm on this type of med, and you say, oh yeah, I know what that is. Get yourself familiar with it. I know you can't learn all of them. I don't expect you to learn all of them. But hey, try to pick up on some of them. And final thing is, you know what? Just be yourself. Be kind to everybody. It's a hard job. And this is the field that we've chose to be in. So do it. Be the best you can. And be the best EMT that you can be. I've enjoyed talking with you, and I hope you've learned something. And again, my email address is emsrescue60, that's 60, @gmail.com. Feel free to email me with any questions or concerns that you may have, and I look forward to talking with you again.